As a nurse, you value the health and welfare of your patients. Sometimes you are able to create a relationship that truly gives meaning to your work. Maybe you have thought of hospice nursing as sad or not as meaningful. Hospice nursing is life-affirming. We support life every day. It's about living out your days on your terms and with a focused and positive outlook. We honor the desire that most people have to live out their lives at home with each day as a gift.
This is one job I can say that it lifts me up, but it's something about this type of work that rewards you. Just knowing that you are a part of somebody's journey, to tell them that it's okay, or holding their hand.
I choose to be a hospice nurse because I get to spend quality time with my patients and families. If I only need to see 3 patients in one day, I can see 3 patients in one day. I can see 5 patients tomorrow. But I can choose a specific patient that needs more time, and you have the ability to focus on that. And I'm not confined into 4 walls, and I'm not punching a time clock. That to me makes it all worthwhile.
I'm here to support our home care nurses and help them do whatever it is they need to do their jobs. For me, I empower them by allowing them to make their own decisions about how to set their schedule. But a large part of what we do, we are the eyes and ears for Dr. Baderi or whatever doctor it is. You know, what they do is based upon what we see in that home and report back to them. So it's important that we go out and we do the assessment and do it accurately and get that information to the physician so that they know how to treat or manage the patient. They also have another support system, which is their team. Our patients and families benefit from having a team approach because you've got different support systems in place when you have, a nurse, a chaplain, a social worker, the nurse aide. But the team all works together to meet the need of that patient and that family too.
I feel hospice is the only field that embraces patients as human beings in totality, taking into consideration their aspirations and their history and their legacies and their families. I do not just give an order. I want to hear from them first what their assessment is. And without that, I cannot make appropriate orders because I'm not dealing with only a symptom, I'm dealing with the patient as a whole. And the nurses will tell me that important information.
People tell me, how can you do this kind of work? I said, this kind of work is saving me. It really is. It's keeping me grounded. It keeps me humble. When I walk out these doors, I see the world in a different perspective. That's the best part of this job.
I enjoy their visits. It's a wonderful thing to have. Makes you have a better outlook on some things that you thought was just like the end. It's not. You just got to look at it different.
It's about living every day you've got, and that's what we want our patients and families, and we want our staffs to have a life too outside of hospice. That's why we try to make sure that there's a good mix of work hours, but hopefully a mix of free hours. I would encourage anybody to give home care a try. Don't be afraid of it. It's okay. And don't be afraid of hospice. Hospice isn't a bad thing. There's a lot of good days. We have graduation parties. We've had birthday celebrations. We've had weddings. We've done a lot of different things.
In our hospice, I feel that we're a family. And I think that makes us stronger. And it's like we're a family providing care for families and for patients. And I'm always reminding the nurses and myself, really, that what we do, it's life-transforming for the patient and their families.
You're going in and you are a part of that patient's and their family's life. You're helping them to live their life on their terms.
With nursing, there are so many fields you can get into. But if you want a reward, the best place to work is at hospice. When you see that patient lying in that bed and you place yourself there, you treat that patient the way you want to be treated and you wouldn't go wrong. And that's the best reward you could ever have.
I'm there for My teams. On bad days, and you think you just can't do it anymore, I always go back and think, you know, I do this because of them. They are, for me, they're the backbone of the hospice care. I'm just there to support them and help them navigate through that. And I think our patients and their families are lucky to have the staff that we do, and you know, we always want to add to that and bring on board more good people to help take care of our patients and families.
The autonomy and respect that hospice nurses have is unparalleled in any other medical fields. I'm gifted every day by being honored to serve patients and families, being allowed to enter their lives and be part of a very difficult time of their journey.